Oh yeah. Welcome everybody. If you are an adult and you're trying to figure out about ADHD medication, should you start them? Which one should you try? How should you experience this? What should you stay away from? This is your live stream. If you have questions, put them up and I'll respond to them. If you're watching this on the upload, put in the comments and we will respond. Thank you for watching. I'm Dr. Noble. Let's get started. ADHD. Here's the questions that I want you to think about. You have to consider the cost. Is there a perfect medication strategy? No. Is there a perfect medication candidate? No. But there are questions that you can ask of yourself and in conjunction with your primary care provider to get a better sense about what is right for you. Questions to ask before you start. The reason why I'm making this video, it's not only because I prescribe medications. I'm a developmental behavioral pediatrician, but it's also because I've been on these medicines. I've been on all the medicines. I got a whole story about it that I put up in another video that you might find beneficial. Here it is. Here's the thumbnail. And in this thumbnail, I talk about my journey. So today I'm going to talk to you as a prescriber. Okay, what should you be thinking about as a prescriber? When I'm prescribing a medication, questions that I think you as an adult need to ask yourself as you prepare to go on your ADHD journey. But I'm also helping you think this through as somebody who's been on all of these medicines. And I can tell you from personal experience, there's tremendous benefits and there's some drawbacks. So that's why we're making this video today, because I got some real experience on this topic. The first question that I want you to ask yourself, are you impaired? Okay. Now I know how that sounds. You're probably thinking, of course I'm impaired. I'm watching a YouTube video about ADHD. I got to be impaired, right? But that's not what I mean. Impairment is something that you really have to interrogate. You have to dig down deep and you have to define for yourself. And the reason why is because we're manipulating the neurochemistry of people's brains to do this. Like, we're going to manipulate your dopamine and norepinephrine pathways, okay, to try and assist you in focusing and attending to tasks so that you can be more successful in the areas of your life that matter most. But before we do that, we really have to define the terms. Are you actually impaired? Not TikTok impaired. Not YouTube impaired, okay? It's not just that you're annoying or that you're not the smartest person in the room or you didn't get every possible promotion that came across your desk in your life. That's not what I mean by impaired. Let's talk a little bit about it. Listen, ADHD problems in adults looks different, okay? It looks different for everybody, all right? It looks different. It looks like a lot of different things. Details, all right? Let's talk about details. Let's talk about the details, the long tasks, the listening, and the organizing of information. This is like death to you. This is like death to you, right? The longer somebody talks about the things that need to be done, you're just like slowly dying in a coffin of impulsivity and hyperactivity, right? Listening and details and tasks are difficult. Instructions, sustained attention, keeping track of things, keeping track of stuff. Right? It's difficult for you. And it's not just subtly difficult for you. It's impairing to the extent that you cannot conduct yourself in a manner that accurately reflects your abilities as an adult, as a parent, as a spouse, as a coworker. It's being able to sit still and use your inside voice. It's listening attentively, right? It's waiting for any reason at all. Waiting for any reason at all. Here's a question. Let's pop it up. Dennis, it's good to see you again. Thanks for tuning in. Do stimulants help people without ADHD? 100%. Okay, but let's talk about it, Dennis. Let's talk about all you people watching this. Okay, so if stimulants help everybody, how do you tell the difference between individuals with ADHD who legitimately benefit from the neuromodulation of their dopamine and norepinephrine pathways versus somebody who's taken ADHD medications and improving on their ability to take standardized tests? Here's the difference, Dennis. It's in ratios, okay? An individual who takes an ADHD medication, who has a verifiable and legitimate impairment because of their ADHD, are going to benefit this much. I mean, it's going to be a dramatic benefit. And as I alluded to just a minute ago, when I got started on ADHD medicines, I mean, my life dramatically turned around. Spoiler alert, I'm no longer on these medications, and I've got reasons for that, which I'll explain. And I'll put the link to that video in the description below. But my life changed not by a little bit, by a lot. It's the difference between a dark room that you flip the lights on and a dark room that you flip a lamp on, right? Overhead lighting illuminates every corner of the room. So an individual with ADHD dramatically improves when they're treated with a stimulant medication. But individuals who don't have ADHD, right? Or they've not been diagnosed. They don't have, impairments that are significant and profound. They will also benefit, okay? But it's a lot less. Again, it's like flipping on a lamp in a dark room versus flipping on the overhead light. So, Dennis, you are correct. Everybody, you're asking. My answer, everybody can benefit from an ADHD medication, but the difference is the extent of this benefit. So you are correct. Great question. Well, it's a good question. And let's ask your question. So I just got diagnosed with ADHD and started meds. It has really helped me getting my work done, mainly task initiation and staying focused. And I'll tell you, this is exactly what I would expect from somebody who had to figure out how to do this on their own and they got put on an ADHD medicine. For me, it's like I alluded to, it's like somebody flipped the lights on. It's like I was able to be like, what? This is how everybody functions? They function like this? And I remember thinking, wow, what an incredible benefit. And so, Ann, I'm so thankful that you had benefit from this medication, and I want to hear more about it. Let's see your follow-up question. Is there a danger of people with ADHD to build a tolerance and get addicted to these medications? Oh, I love this, Ann. I love this question. Okay, before we get into this, let's define some terms. Let's define some terms, Internet and YouTube, and let's be nice, okay? Because sometimes what will happen is, and I will talk about this, and I will say in the video of my own personal experience, I talk about one of the many reasons I quit taking ADHD medications was because of withdrawal. I didn't like the withdrawal. And then somebody got in the comments, and they're like, well, sounds like you're addicted to these medications because you had withdrawal. And here's what I want you to say, okay? When you're doubting yourself and you're concerned, when you tell your family, you tell your friends, you tell your coworkers, and you feel that judgy, like, well, she's just addicted. And I'm telling you, you're not addicted, okay? Individuals who take these medications, not addicted, okay? But do they develop dependence? Oh, and that's a different concept. Let's talk about dependence. I take an ADHD medicine. I develop a dependence. I take, you know what else? I take a blood pressure medicine. I develop dependence. You abruptly stop my blood pressure medicine, what happens? My blood pressure goes up. I take a medicine for migraines. I take a medicine for seizures. And you could say, well, you should take these medications. You're addicted. You don't develop an addiction. You develop a dependence, and they're not the same thing. So is there a danger to building up a tolerance and getting addicted? I talk about that a little later in this presentation today, but one of the many reasons that you should steer away from stimulant medications, so like ADHD specific stimulant medications, is if you have a history of addiction. So if I'm an adult and I had previously, I had another person in the comments, wonderful person, said, look, I don't take ADHD medications. I don't take stimulants because I had an addiction to cocaine. And I said, and I replied back, and I'm like, man, that's all. Thank you for your transparency. Thank you for knowing your limits and your dangers. I appreciate that greatly. So individuals who have an addiction history should very much shy away from medication strategies that could lead to addiction. Now, are ADHD medications abused? Yes. Do individuals who have a propensity towards addiction abuse these medications? Yes, but if you're taking them as prescribed and experiencing the tremendous benefits that they can offer you, and when you skip a dose, you have a rebound in impulsivity, rebound in attention or hyperactivity, that doesn't mean you're addicted. It means you have a drug dependence, which will improve with time, just like any other medication that you would take. So please understand, you're not depending on these medications to be effective in your life does not mean you're addicted. It means you're dependent. They are different things. If you have a predisposition towards addictive tendencies in your life, ADHD medications, which in this case are stimulants, are probably not a great fit for you. And I hope I answered your question, and I'm thankful that you found benefit in these medications. If there's additional questions, you put them right up, and we're going to get right at it. Okay. Now, ADHD symptoms in adults looks different than kids, right? You're not out of your seat. You're not giving people wet willies in the boardroom, right? You're not putting whoopee cushions under the seat of the CEO so that you can get fired because you're so impulsive and wild. That's not you. But if you're unable to be effective conducting yourself as a coworker, colleague, parent, and friend because you're missing so many of the details of life, my friends, it's possible that you are stepping into a level of impairment. So everybody defines that a little bit differently. But as an adult, the first question you have to ask yourself is, are you impaired? Not are you annoyed? That's not what I'm talking about. And that's not what I'm talking about. Dennis, that's not what we're saying here. People who receive the most benefit from these medications are impaired without them and dramatically benefit for them. It's like taking all the smoke out of a room. Now you can actually see what needs to be done. So that is what I want you to take away as you think about impairment in your life. You take these medicines not because you're weak, not because you're unable to get organized, it's because you're impaired. And because impairment leads to real problems in your life. And so if you're taking these medicines and you know that you're impaired, proceed. Or if you're thinking about taking these medications and you know, based on what we just talked about, you're impaired, proceed, my friends. Okay, let's keep going. Now let's talk about the next concept. The next concept, after we determine if you're impaired, is asking another set of questions because we're adults. Now I do treat young adults with ADHD. I care for individuals with intellectual disabilities into adulthood. And so adults have a lot more moving parts. They just do, right? They have a lot more moving parts. Sometimes they have hypertensive medication. Sometimes they're on diabetes medication. So as an adult watching this, you got to ask yourself, what medicines are you taking? Like, what are you taking right now that we need to know about that could cause problems? So here is a list of medications or medication kind of groupings that if you are addressing in your life, you should really think twice if you're pursuing an ADHD medication to augment these current strategies. Metformin. So if you have diabetes type 2 or you have pre-diabetes and you are on metformin, okay, that's an important thing to let your prescriber know. Now, most prescribers will know that because they're looking at your medical record, but I don't know. Sometimes we see people who don't ask the right questions. If you're being treated for anxiety or depression, now, anxiety and depression can be co-occurring conditions. They can occur right alongside ADHD, and treating an individual who's being treated with anxiety, depression, and ADHD is not bad. It's not wrong, but it kind of depends on what medications you're currently taking. This is a list of medications: Marplan, Nardil, Emsam, Parnate. These are medications that are in the category of monoamine oxidase inhibitors. They're one of the earliest, if not the earliest category of medications developed to treat anxiety and depression. So if you're on an older class of medication to treat anxiety or depression, please know that treating with a stimulant medication for ADHD is not advised. Antiepileptics. If you have a terrible seizure disorder, okay, and I see a lot of kids with this, a lot of individuals with neurodevelopmental disorders can have underlying seizure disorders. And if you have that as a complicating factor, know that it is possible that your seizure disorder, your seizure threshold could get lowered. It could get lowered. I don't see that a lot, but it's a risk, and you need to be aware of that. By starting an ADHD medicine, it could potentially make seizures worse. Anticoagulants. If you're taking medications to thin your blood because you're predisposed to deep venous thrombosis or something of that nature, you have an indwelling device that mandates anticoagulants, you have to really think twice about using ADHD medications. And lastly, antacids. I thought this was a good one because these are medications you can be taking. Some of them, you can be taking them pretty easily. A lot of people do, but these are PPIs, or proton pump inhibitors. Okay, so this isn't like Zantac. This is a different type of thing. Prevacid, Prilosec, Protonix, Nexium. If you're taking medications in that category, proceed with caution. Okay, proceed with caution. Next up on the list of things to think about when you're pursuing or thinking about an ADHD medication strategy is the question of what is your medical history. It's a little different than what we just talked about. Those are what are medications. There's some overlap here, but Sometimes you can have a medical history that doesn't require a medication, but still puts you at risk if you were to start a stimulant medication for ADHD. Let's look at it. Here is a long list, right? Cardiac issues, hypertension, diabetes, anxiety, tic disorders, right? Glaucoma. These are things that could potentially worsen with the use of an ADHD medication. Bipolar, psychosis, mania. Listen, if you are struggling with bipolar disorder, right? You have you're rapidly cycling or you're experiencing extreme highs and extreme lows. Know that using an ADHD medication, a stimulant medication, could potentiate some of those issues, could make some things worse, right? Priapism, which is prolonged erection. That is a real risk. If you've experienced that with other medications, you got to really be careful if you have that as a side effect of other medications or a current condition that you're struggling with. This could make it worse. GI issues, right? They can cause gastritis. They can cause constipation because you're not drinking enough. Pregnancy, breastfeeding, right? Active psychosis, which we discussed already. These are things that you want to steer away from. If you have these conditions, you might want to really think twice about the necessity of an ADHD medication and most certainly address these concerns with your provider. And lastly, history of drug abuse, right? I mean, we talked about this already. If you're somebody who knows that you have a propensity to take things too far, you really want to think twice, and you're going to want to understand that while some people will still use these medications to treat you, there's going to be a lot of scrutiny, okay? There's going to be a lot of scrutiny. They're going to watch you close, and they're not trying to be mean. They're trying to keep you alive, okay? So what medications are you taking? What is your medical history? Now, let's talk about side effects. Side effects. ADHD medications have got them. And they're very, very predictable. It's like I've got a magic crystal ball. I tell families, listen, I can tell you with absolute certainty what you're going to love and what you're going to hate about these medicines because I've taken all of them and I prescribe them for 20 years. So let's talk about side effects because, listen, if you're not willing to tolerate these, an ADHD strategy is probably not for you, all right? So choose your problems. Choose your problems. Okay, let's talk about the stimulants first, because I know I'm speaking in broad strokes about ADHD medications, assuming they're not all the same, okay? Primarily when I talk about ADHD medications in these talks and in previous talks I've done, I'm talking about stimulants. Stimulants are things like Ritalin and Adderall and Vyvanse and Concerta, things that most of you are either thinking about taking or are already on. Stimulants. So let's go all the way over and look at the stimulants. So you're going to have a decrease in appetite. You're going to have irritability. Likely, you're going to have some insomnia if you take the medicines too late in the day or if you're really sensitive. You could have some heart rate and blood pressure issues, right? It's going to kind of speed up your heart rate, could increase your blood pressure, right? So which is why if you have pre-existing conditions from a cardiac perspective or blood pressure, again, proceed with caution. GI issues, okay? So it can have irritability to the gut, but also you don't eat the same amount, you don't drink the same amount during the day. You can get kind of dried up like a prune. You can have some GI issues. Constipation is an example. Stimulants can also worsen anxiety and depression. Anxiety and depression. I mean, as I've said, I've been on these medicines. They can make you kind of tense, right? These medicines don't come to bring peace. They don't come to chill you out, right? It's not a peaceful, easy feeling. They're taking you to the edge, right? They're taking that car and they're going to have it idle at 6,000 RPMs. For 4 hours or 8 hours or 12 hours, you're going to idle at 6,000. You're going to have 6,000 RPMs. That engine's going to be hot, right? And the reason for that is because it takes a kind of a diluted light and it makes it into a laser light show, right? The stimulants kind of focus your ability to attend a task by addressing the neurotransmitters involved in those pathways. Okay, so that's the stimulants, right? So choose your side effects. If you're somebody who's, maybe you don't want to lose weight, or maybe you've got increased blood pressure, or you are already kind of an irritable person and you don't want to make that worse, or you could experience that as a side effect. If you get more irritable on these medicines, that's what it is. It's pushing you too far. That car is idling too hot. Let's talk about alpha agonists, right? Because there's other ways to treat ADHD. It's not just stimulants. I would argue they're the best way and the most evidence-based way to do this, but they're not the only way. Alpha agonists, so things like 10X and clonidine. Okay, fancy word, these are blood pressure medicines. They're blood pressure medicines, and they can do what blood pressure medicines do, right? They can calm things down. So this is like taking a wet blanket and throwing it on a hot engine. That is essentially what alpha agonists are like. So you can have hypotension, you can get dizzy, right? These are medicines that you can't just take or not take, right? If you skip a dose, you might get dizzy, your blood pressure might be negatively affected. You might have erectile dysfunction, right? Because these medications, again, they affect blood pressure. They affect, and so they can really kind of slow things down for a little bit for some of us. These are really good for individuals who are hyperactive and impulsive, right? There can be some real benefit to those. And then lastly, selective norepinephrine reuptake inhibitors, SNRIs. These are medicines like Strattera and Qelbree. Okay, these are medicines that they're not super new. Qelbree's new, okay? But these medications are non-stimulants that can still manipulate the neurotransmitters to help you attend to task and focus, but they don't have all the typical side effects of stimulants. So you can take these at bedtime. Take them at 9 o'clock at night. They work all the next day, right? They don't keep you awake. They don't have terrible, terrible side effects like, increasing in anxious features or GI complaints. But to be fair, those side effects still exist, but I would argue to a lesser degree than stimulants. So you can still have some GI issues. The most common reason that I stop these medications is because of nausea. You can have, abdominal pain. Some individuals are really sensitive to this and they can have pain over where their liver is. And because their liver is inflamed and super mad. And then you got to get blood levels. You got to get off this medicine. That is some of the most dramatic side effects that I've seen. But in truth, these are pretty benign medication strategies. They're really good for people who don't or can't tolerate traditional ADHD approaches. They don't want to lose the weight. They don't want to be irritable. They already struggle with sleep. They already have a BMI of like 11, right? They're already really thin and they just can't handle losing any more weight. These, or some people who have co-occurring conditions like they have anxiety, they have ADHD, they want to treat them both. Two birds, one stone. Sometimes an SNRI like Strattera or Qelbree can be really good options. But there's also cardiovascular risks here as well. Heart rate, blood pressure, things like that. So it sounds a bit like a broken record, right? Any medication you take is going to have benefits and it's going to have side effects, right? But in general, any medicine that works, any medicine that has effect has side effects. If you're taking a medicine and you're like, well, no, it's like a Tic Tac. I have fresh breath and I'm taking a medicine. It's probably not doing a whole lot to help you as it relates to ADHD. Okay, so just remember that, kind of tuck that into your pocket when you go through these systems and think about that when you're on strategies that aren't dramatically useful. It could be because they're not going to be useful. So choose your problem. Before you start an ADHD medicine, know that nobody gets out unscathed. What problems are you willing to tolerate? Okay, next up, let's talk about duration of action. But before we do that, Anne's got a question. Can you talk about drug holidays? Are they necessary? If so, how long and how frequently do you recommend? Anne, you got great questions. Let's talk about this. Okay, yes, in general, if anyone says to me, hey, Noble, do you think I could stop? I very rarely care about what they say next. My answer is always going to be yes. I do not, what I mean by that is yes, please stop. Okay. Now, that's a general broad stroke statement. That's not true for everybody. Okay. This is a YouTube video, not a doctor visit. All right. So of course you've got to work with your doctor to figure out other things. But in general, if we can get people off medications, I want that. If it's only for a weekend, if it's for the summer, if it's for spring break, I want it. The benefit of ADHD medications, stimulant medications, okay, is that you can take them or not take them. Now, if you're on the max dose of a stimulant medication, the maximum dose, you're on 70 milligrams of Vyvanse and you're just rocking that. Is it a great idea to just stop that the weekend of your daughter's wedding because you really want to enjoy cake? You might end up putting your face in the cake, so you got to proceed with caution. But in general, and I'm speaking from personal experience, And I took these medicines when I needed them. I did not take them when I didn't. And I just dealt with what came with it. My appetite was better. Oftentimes my mood was a little bit better, right? I was a little more fun, but I was certainly more impulsive. But in general, what I want you to understand is if you can take a drug holiday, do it, because it's less medicine that you're taking. It's less neuropharmacology that we're doing on the brain. Okay. But it's not necessary to take a break. Most people, right, when they are experiencing dramatic benefits from an ADHD medication, it's hard to hang that up for 48 hours. I'm like, well, I guess I'm just going to go back to not getting a whole lot done. You know, nobody wants to walk around Costco and look like they're confused because they might be in the wrong store. Like like nobody wants to look for their car for 45 minutes. Like this is my reality. This is what I experience. And if you can take a break and don't feel bad about it, but you have to be smart. What do you got going on that weekend? If you want to take a prolonged break, okay, let's say you want to come off for 7 to 10 days or a week or a month over the summer, let's say we're talking about kids. I'm a big fan of it, okay? But what I tell families, what I'm telling you, Ann, is if you take a break and the morning doesn't go great and the evening doesn't go great and the next day doesn't go great, that's okay. Your body has to figure out how to regulate itself again, and it will come back online to the best of its ability. Will you be as attentive and focused as you were on your medicines? Probably not. But will you come back to some sort of baseline over a 3 to 5 day period? Absolutely you will. So if you stop for more than a few days and it's a struggle, but you feel like you're slowly starting to get back on track, proceed. Stay off. Go for it. Right? Let's do this. So you don't have to take drug holidays. They are not necessary. But in my personal experience, if I took a weekend off, when I took that morning dose on a Monday, I found it had a little bit more punch. So sometimes if you know that you need a little bit more punch early in the week, sometimes it's not a bad idea to give yourself a break and time it accordingly. Another great question from Ann. Okay, duration of action. Before you start these medicines, you got to ask yourself, okay, a bunch of questions. And one of the questions we have to ask ourselves is, how long do you need these medicines to last? You're an adult. You're sitting in your doctor's office, right? You're sitting in your provider's office. You have to know before you go in there, not just if you have ADHD and if you meet the diagnostic criteria, but a better question is, what kind of coverage do you really need? Okay? What kind of coverage do you really need? I've been on short-acting medicines. I've been on long-acting medicines, okay? And they are different. Let's talk about short-actings first. Let's talk about the good. The good thing within a short-acting medicine is control, control, control. You get to decide when you're going to be at your best, all right? If you don't need to be, if you're just sitting in your office, kind of getting basic things done from 8 to noon, and there's a meeting coming up, a 2.5 hour meeting in the afternoon when your coffee buzz is worn off and everybody wants to take a nap because they just, ate lunch at Pancheros, you might want to think about, just using your medicine in the afternoon so you can make sure that you're fully present and available, right? And if you have a short-acting medication, you get to make that choice, right? You don't have to take the morning dose if you don't want to. Again, you can take it in the morning, you can take it at lunch, you can take it at 10, you can take it at 2. I wouldn't give anything past 2 o'clock, just as an FYI, if you want to sleep. But to be fair, you're an adult. Sometimes we'll dose it later in the day if we have to. So control, control, control. You want to know the benefit of a short-acting medicine? You get to decide. It works quickly. Hey, it works right away. I'm telling you, 20, 30 minutes, maybe less. You're online. I felt like RAM was added to my computer brain within 20 to 30 minutes. I'm like, yep, what problems Noble got to solve? Give me a puzzle. Give me a Rubik's Cube. Give me just do some Jenga while I check email. Okay, that's how efficient and effective I was feeling. So please understand that it works quickly. And I think that long-acting medicines do too, but I don't think they work nearly as quickly as the short-acting punch. Okay, the good is that and another thing, you can plan for side effects. So let's say you want to get a bunch of stuff done, but you're going to go out for lunch, right? And you want to be able to actually enjoy that. You're going to the Great China Buffet, delicious, fantastic. Okay, you don't want to go there with a full functioning dose of a Ritalin or an Adderall, and then you don't want to enjoy. You pay $18 to eat there. You don't want to go there and not eat anything because you can't stand it, right? You're just drinking some sweet tea. No. If you have short-acting medicine, you can plan for side effects and plan accordingly. right? And then the other thing is that if you have a bad experience, okay, let's say you don't really love how you feel on these medicines, but man, they're effective and they help you get stuff done. It's a 4-hour ride. Most all short-acting medications are anywhere from 2 to 4 hours in terms of their effect. So if you don't know if it's going to be a great fit, or you know there's going to be some turbulence on the flight, but you're going to get a lot of stuff done in that 4-hour period, it only lasts 4 hours and then it's gone, right? You're not stuck on a 12-hour cruise that you hate. The bads. Let's talk about the bads of short-acting medications. They're inconvenient. They're inconvenient. You're going to have a pocket full of pills all the time. That's not a good look. These are controlled substances. These are C2s, right? That's not a good look. Is it a justified look? Sure, fine. I mean, you do you. I'm not judging you, right? But I get it. It's inconvenient, right? You're trying to time things, trying to figure things out sometimes. I mean, let's face it. You got ADHD. Half the time you're not even remembering to take this stuff, okay? It's a roller coaster. That's another thing I want you to think about, right? You go up. Okay, you go up high on that first dose and you're getting peak effect and things are great. And then you go down and then you take that noon dose, but the second bump is never as useful or effective as the first. My experience was morning times were great. I take a second dose around 11:30, 12, and it would never quite get me to the same amount of effect as the first dose. So it's kind of like a roller coaster where you're just slowly running out of gas. Okay. And the other thing to think about is short-acting medications have greater abuse potential. They do. I mean, any board question that I answer about these kinds of medication strategies, and they're going to say, what's the greatest risk of abuse potential? It's going to be a short-acting medication. Okay. So again, if that's something you have in your history, or if you're getting a lot of scrutiny from your providers, that's why. Okay. And granted, you can't fill these things early. There's not much you can do. I mean, we watch you pretty closely. But if you have a predisposition to addiction in terms of stimulants, so methamphetamine addiction, things like that, a short-acting medication is not a good fit, not a good look for you. Okay. Think twice about it. And the bad about it is the same as the good. It only lasts 4 hours. So it's in and it's out, right? So then you gotta, you have to time your crash, and your crash is going to be in the middle of the day instead of crashing privately at your home when you're off your medications, right? And you can't get anything done. You don't even know why you're in the bathroom. Like, you're going to end up having a very public crash at around 11:30 unless you dose yourself accordingly, right? So just how public do you want to make this crash? Okay. All right. Now let's talk about long-acting medications, because there's some goods and some bads to those. What's the goods? Well, they're convenient. I mean, for crying out loud, that goes without saying. They're convenient. You take them once in the morning. You keep your controlled medications at home, right? They're locked away in your cabinet, and you don't have to worry about carrying around a medicine in your backpack or in your pocket. They're predictable, right? They start about 20, 30 minutes after you take them, and then they just kind of bleed out throughout the day. Anywhere from 8 to 12 hours have effect. It's less pills at the pharmacy, right? So you don't have like a giant pill bottle that you're having to carry around with you. It's less pills, and it's a 12-hour cruise. I mean, you can guess how long you're going to be out to sea and when you're going to be coming back. The bads, well, here's the problem. You've got a narrow window to decide. If you're not sure that you need to take an ADHD medication that day, well, guess what? You've got until about 9 o'clock to choose. Maybe 10 o'clock to choose if you don't mind being up until midnight the next night. You have to think about that, because you got 12 hours of effect without choosing, and then you don't choose well and you take it too late in the day, you're not going to sleep. You're not going to sleep, and you're probably not going to be eating anything. So when you go out to the Olive Garden, another fantastic establishment, you're not going to eat the breadsticks, and you made a big mistake, my friend, a huge mistake, because they're delicious. All right. It's a 12-hour cruise. Okay. Again, I know there's some goods and some bads, and sometimes they overlap each other. But if it doesn't go well for you, it doesn't go well for you for 12 hours, right? I'd rather take a jet ski. If I'm going to go out and not sure I'm going to like something, 3-4 hours, I'm back. But a cruise, you're trapped. It's not like you can go on a Disney cruise and change your mind after 12 hours because you're puking all day. Nope. If you're on a long-acting medication, it's a 12-hour cruise, whether you like it or not. If there's turbulence, there's going to be 12 hours of turbulence, my friend. And listen to this. The pulse may not be when you need it most. It may not be, and what do I mean by pulse? When you take a short-acting medicine, 20, 30 minutes later, you're going to have a pulse. You're going to have a boost. You're going to have an upload of RAM, and boom. Give me stuff to do. I'm ready to do it. I can predict it. If I take it before I leave, it's a 30-minute commute. By the time I get to work, I'm ready to get to work. right? Same thing, I'll take it at 11:30. But when you take a long-acting medicine, the pulses are still embedded within the release system, and they vary. Sometimes there's 30% immediate release, 70% prolonged release. Sometimes it's 50-50, depending on the medicine that you choose. There's still a pulse, but you don't really get to predict when it hits or how it hits. And so you might be in the middle of, a car ride, and now you're getting a pulse of benefit that you don't really need at that time. So long-acting medicines can be problematic in terms of being able to control when the pulse comes. Okay. Now, we're getting into this. Here's another question you got to ask yourself before you start an ADHD medicine or you go down this road. What else have you tried? Okay, listen, again, I didn't spend all of my 20s and half of my 30s, okay, deeply entrenched in medical education and passing tests and getting screamed at by people just so that I can put people on medications, right? That's not the end all goal of my life. It's to see you live the best life that you can live. It's to see you reach your potential. That's why all this exists. And in order to help us reach our potential, we have to take some ownership of our side of that equation. We can't keep looking into the distance for the right medication, the right strategy, the right physician, the right online assessment tool, the right job, the right spouse, the right friendship, the right waiting line. We can't always look for external factors to try and figure out how to be the best version of ourselves. Okay? We have to take some ownership of this. And I want to ask you, before you seek pharmacology for life enhancement and direction and purpose in terms of getting things done, we have to ask some questions about what you've already tried. And listen, there's a lot of things you can do that are not medication related. Complementary integrative treatment strategies. I love these. I've done some videos on these. I linked them in the description below that you can go check out. How about restriction and artificial food additive diets? Let's get those things out. So think about getting rid of things like food preservatives like sodium benzoate or food colorings. Let's get rid of things that exist in the middle of the grocery store. Okay, and I don't mean to sound presumptuous or in terms of like the cost of those types of strategies, right? If you shop around the outside of a grocery store, you're likely going to avoid some of the additives and food dyes that we're talking about here. But that takes time, it takes energy, it takes resources. Not everybody has those, and I respect that. But this portion of the talk is about taking some ownership over this problem, right? Omega-3 fatty acids. Yes, fish oils. Okay, fish oils. Omega-6 fatty acids is kind of like what you think of as a Western diet, right? So saturated fat, fatty oils, right? And those things have downstream revenue which are all precursors to inflammation, right? The kinds of things that come from the omega-6, the Western diet stuff, it can lead to inflammation, which you probably read a lot about if you know anything about complementary integrative treatments. There's truth to that. There's science to that. Now, is it tremendous? Does this mean that if I look at your gut with labs, I'm going to see inflammation? Probably not, but there is some truth to it. But omega-3 fatty acids are things that you can add to your diet that could really help you. Now, I put barracuda here as a joke. Okay, but what I want you to understand is cold, saltwater, freshly caught fish. Okay, so barracuda, there's a bunch of different ones, but I just like barracuda the best. But the bottom line is, if you eat fish in your diet, okay, that's high in omega-3, you're going to take in an astronomically larger amount of omega-3s than you will by choking down those horse pills. Those horse pills, they look like they have honey in them. It's not honey. There's no honey in there. Learn that the hard way. Don't chew those babies. It's gross. But you choke those babies down and you're going to get some benefit from an omega-3 standpoint, but not nearly the benefit of just going and eating some fish. Flaxseed, chia seeds, it can also be plant-based. It doesn't have to come from fish. But adding omega-3, there's no question that there is some benefit in regards to the treatment of ADHD by removing certain articles or items from your food and by adding things like omega-3s. Okay. I'm going to say this and don't get mad at me. Sleep. Look at me. Hey, if you're drinking rock stars all day, okay, and you're taking caffeine pills, guilty. Okay, but if you're doing that stuff and you're not sleeping and you're up gaming all night long and you just can't get it together at work and you're eating at Hardee's every day, no offense to Hardee's, There's some things that you can do to clean that up on your side of the equation. Don't go looking for complex neuropharmacology to address your unwillingness to take ownership of your side of the equation. Please, please sleep. 8 to 12 hours. Don't be on stuff. I'm not lecturing you like your kids. I know you live your life, but we've all been trapped in the death scroll, right? All of a sudden I'm on TikTok and I'm watching amazing comedians, and then I'm watching people, and then it just gets, and then it's 2 a.m. Don't go to your doctor and say you can't focus and attend to task if you don't sleep and you don't exercise. Look, I'm not trying to lecture you. You do you. Life is hard. Life is so hard, okay? But get out there, give yourself some endorphins, sleep, give the world the best version of yourself you can. And the difference between what you're able to produce and what you should be able to produce, that's what we want to address with medication. So please show up, do your part, clean it up as best you can, and then think about medication strategies. Okay. Now, I want to share briefly with you my story. Okay. I want to get into this just real quick. It won't be long, because I think you deserve to know why I was on a medicine and why I'm not anymore. Here's a thumbnail of the video I put out. Doctor quits ADHD medications. Find out why. When I made that video, 40 people watched my videos. I had no idea that 7,000 people were going to watch this video. I would have put different music in. It's terrible. You're correct. But I do have some really good points. And one of the points that I want you to understand as I get into this was on, that's me now, okay, in the blue, the thumbnail, that's how I look, that's me now. But as you can see, look at this guy, this other guy, that guy with the stethoscope, that was me on ADHD medications. It was on me on ADHD medications. This me could eat that me for breakfast. I look like a scarecrow, okay, who woke up naked inside of a Gap or a Banana Republic and said, oh no, I better put on some clothes and get out of here. So I'm going to grab the closest thing I can find. That's the life I was living. And I see that photo and I see my eyes sunken, and I was starting a developmental clinic, and I was super stressed, and I wasn't sleeping, and I wasn't eating, and I was 30 pounds lighter. And listen, it wasn't just about looks. It wasn't just about looks. Okay. But it didn't feel good. It just didn't feel good. Here are the 6 reasons that I quit taking these medications. These are my reasons. They might not be yours. They might not be yours. And this is not me on a soapbox telling you how dangerous and terrible, because people don't even watch all the video. They just watch the title. They look at the title. They watch 30 seconds and they just start saying mean things about how I'm against this. I'm not against this. I just want a balanced view for you. I got off these medicines for 6 reasons. I did not like the weight loss. I did not like the crash. Okay, I have 4 kids. I got to be at my best when I come home. I can't be on empty. I got to pull over and fill up the car and get ready to go round 2 because my kids are waiting. I didn't like the dependence. Now, as I told you, dependence is typical with medications that are effective. Stopping a medicine. I was talking to Ann about this. Stopping a medication and having a withdrawal features of that doesn't mean you're addicted. It means that your body is finding its new normal after you discontinue it. Same thing with blood pressure medicine. Same things with ibuprofen, right? You can have rebound issues that don't last forever, right? It's not like you're going dumpster diving and robbing convenience stores to try and get prescriptions. That's going to put you in the addiction category, okay? When you're willing to do whatever it takes, no matter what, even if the medication itself is terrible for you, to get more, that's a little different than having a headache and not being able to send emails when you stop a medicine, okay? So please understand me. I didn't like the withdrawal. I didn't like the idea of feeling I had to depend on something to get my work done. And there are seasons when I did, okay? I took these medications because I was struggling to pass board exams. I was struggling to be successful at the level that I was at with medical school and residency and fellowship. So I graduated to my level of impairment, and some of you listening to this did the same thing. You did the same thing. You didn't need it when you were in high school or in college, but now you're a lawyer. Now you have a level of output that is required of you that is stressful, intense, and I'm not trying to beat you up. You take these medicines if they're helpful to you. You do it. Okay. You keep it balanced. You keep it legit, right? You know the lines and you don't cross them. Okay. And you're going to do great. You're going to do great. But for me, it got to the spot where it was less about what I was able to do and more about how many pills I had left to do it. Okay. And I just didn't want to live that way. I thought, look, if I crash and burn, I crash and burn. And lastly, sustainability. You saw the picture of me, the naked scarecrow man who woke up in the Gap and had to steal clothes to survive and run, like that's how I felt. It didn't feel sustainable, right? It didn't feel sustainable. I didn't see how this was going to end well for me. And so I got off. But listen, that's not your story. So don't beat yourself up. But if you think it is, shoot me, give us a comment. Let's talk about it because maybe we need to transition away. Okay. Here's my recommendations. You've been patient. You've been kind. It's been super fun to interact with you folks. Let me end with some recommendations because I think you deserve some takeaways. All right. Here's my takeaways. Number one, think about impairment. Really, really, really think about impairment. Not just what you saw on TikTok, not just what the person in the cubicle next to you told you they experienced with them. That's not your life. That's not your life. If you feel like you're impaired, you're getting fired from jobs, you're tortured in relationships, your life is a never-ending series of to-do lists that you lose, right? You got it on your phone. You got it written down. You wrote it on your palm. And it's like somebody just came in and wiped it away. Like you build a sandcastle and the tide just comes and washes it away constantly. And your life, you feel like a dumpster fire. You're impaired. You're impaired. Okay. But some of you, if you're like me, there's seasons of life when you are impaired, but then some of you, you're not impaired. You're looking for something, right? There's a void in your life. You want to try and optimize things. You want to grow. You want to try something new. You want a little punch, a little push. And believe me, I get that too, friends. I get that. And I don't think that that's a path you want to go down. Okay? Only you can decide. Only you can decide. But really think about, are you really impaired or do you just need to change? You just need to start exercise. You need to go outside yourself. You need to rethink some things. That's okay. No one's blaming you. Know your risks. Hey, know your risk. And you're not like sitting over here smoking like, that's my doctor's job to know the risks. I mean, blah, blah, blah. Listen, we're not mind readers. Okay. We don't know. We don't know what you're up to. We don't know how much alcohol you really drink. We don't really know what you're up to. We don't know what recreational drugs you'll dippity-doo-dah day in. We have no idea. You got to tell us. And that's why I'm making this video so that you can learn how to quantify your own risks. Your diabetes could get worse, right? Your seizure threshold could lower. Is it worth it? I don't know. Prepare for side effects. Don't take these medicines and then come back to my clinic or somebody else's clinic and be like, Noble, I'm not eating and I'm not sleeping and I'm just frustrated and it's going terrible. And I'm going to say, look, I care about you. I think you're awesome. Why are you telling me about stuff I already told you? Okay, listen, if the juice isn't worth the squeeze for you, don't be surprised when these medications cause side effects. Take home point here, if the medications for ADHD are effective, then they have side effects, all right? If you're one of the rare few people who are taking Concerta 27, Concerta 36, Vyvanse 50, and you're like, I don't know what this guy's talking about. I got no side effects. I'm doing amazing. Okay, great. That's rare. Most of you, if you're not seeing the effects you need because you're not seeing the benefit of this medication, you got to go up. Okay, within reason, under the guidance of a prescribing physician, you got to go up because typically if you're getting side effects, you're getting benefits. And if you're getting all side effects and no benefits, then you're on the wrong medicine. You got to get off. Okay, so prepare for side effects and be ready for them. Is this a season when you want to do that? Right? Maybe you're training for an ultra marathon. Maybe you're preparing for the birth of a child. Is this really a season that you need to go on an ADHD? You have to ask yourself that question, right? Maybe there's a different season for you. Do what you can do first. Do what you can do first. Clean it up. Clean up the diet. Get rid of the junk. Exercise if you've got it in you, right? Do the things that you can do to stay away from medicine. Not because it's bad. Not because it's wrong. No, that's not what I'm saying. I'm saying that medication should be the last resort, not the first resort, right? Do what you can do first. I promise you, it will pay dividends over the long term if you learn how to manage these things as best you're able on your own. Okay, decide on your timeline, short-acting or long-acting. Short-acting or long-acting. Okay, what do you want to do? As I've said, and as I'm saying here on this slide, if I have to tell you something as a friend, okay, if you're somebody who does not have a predisposition to addiction, all right, you've not had an addiction to illicit substances like methamphetamines, okay, and you know that this is something that you feel like your discipline, you only need effect for certain ports or certain times of the day, Okay, what I want you to understand is that a short-acting medicine is probably best for you to start. That's how I was started as an adult in my 30s by a psychiatrist. And I'm telling you, it was great. I took it when I needed it. I didn't when I didn't. I had ventured over to the long-actings. I tried all those and that was fine. But I got to tell you, they didn't have enough teeth. It was more just like, like I needed effect during certain periods of the day. But when I got on a long-acting medicine, it was like just like a giant blanket got pulled over my whole day. You know what I mean? It's just like it kind of worked all the time and I wasn't really hungry, but there wasn't any punch, there wasn't any teeth, there wasn't any grit. If I'm going to manipulate the neurochemistry in my brain, if you're going to do the same, you do a medicine that's going to work. Do a medicine that's going to work when you need it to work. So listen, I like short actings for that, okay? Is the juice worth the squeeze? Are you willing to pay the price to do this? And if you are, do it, my friend. But go into it with your eyes open and your head up. If this is useful, like and subscribe. Like and subscribe if this is useful because that's how I get more content to more people. There's a few more questions here and then it will be done. Why do different brands, look at Dennis, look at this guy. I love this. This is so great. Why do different brands of methylphenidate have different maximum dosage? This is a great question. Despite the active ingredient being the same, you are exactly right. Dennis, you're exactly right. Let's talk about it. People get confused. I'll say, hey, what do you think about Ritalin? I'm like, oh, no. I don't want to take Ritalin. I don't feel comfortable with that. Okay. Then I say, all right, how do you feel about Concerta? Oh, Concerta's much better. Concerta, I'll totally do that. I've heard great things about that. Dennis, you already know the punchline. Same medicine. Same medicine. Active ingredient, methylphenidate. There's two kinds of stimulant ADHD medications. Methylphenidates, so Ritalin, Concerta, Daytrana, blah, 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 blah. And then there's amphetamines, so Adderall, Vyvanse, and a bunch of others, okay? There's two kinds, both real similar in terms of their effect. I have some videos on that if you're curious. But why do they dose it differently? Okay, in Spain, the upper limit for Concerta is 108 milligrams. True, same in the States. I don't know what Rubifen is. I don't know what that is, but it's obviously a methylphenidate product, and it's a 60 milligram dose, so it could be Metadate. Could be the United States version of that medicine, but it's a methylphenidate, SR sustained release. So again, I don't have to know the name to know what that likely is. And Dennis, I'll tell you, I think it has to do. I don't know if it has to do with the way it's pulsed, short versus long acting, right? Immediate versus sustained release. I don't know if it has to do with the release system. So Concerta, right, is a horse pill. You have to swallow it, and then it slowly just peels off in your gut. Whereas Metadate, okay, or it could be Ritalin LA. That might be what Rubifen is in Spain. But it's a capsule where there's granules. Okay. So in general, I'm going to zoom out for a minute. In general, if I think about it in terms of milligrams per kilogram per day. Okay. So the top end doses might be different, but if we think about what's the top end dose for somebody, I tend to think about it in terms of milligrams per kilogram per day. So if you're on a methylphenidate product, 1.5 to 2 milligrams per kilogram per day is probably your top dose. So maybe Concerta goes up to 108 because you're treating a lot of adults. Maybe their body mass index is bigger, and you can get all the way up to 108 milligrams because they're anticipating more of an adult population. I don't know. Versus, like a Metadate CD or Ritalin LA, which is a 60 milligram per day total. Maybe it's because it's a capsule and it has a different release mechanism. But in general, if you want to know where you are in the story, do the math. Milligrams per kilogram per day. If somebody comes in and they're on 2 milligrams per kilogram per day or 2.5 milligrams per kilogram per day of an ADHD medication, let's say they're a good, let's say you're an adult, the likelihood that somebody who can do the math is going to increase that medicine is very, very low, even if you're not at the maximum daily dose, right? So if you're not at 108 milligrams of Concerta, you might want to think about, but you're at 2 milligrams per kilogram per day, you might want to think about making a change. To be fair, they don't really base these dosed on weight anymore, but I'll tell you, good clinicians still pay attention because you don't want somebody on a donkey-sized dose of this for somebody who's built like who's like a small adult. You don't want to do that. So Dennis, I am not answering your question well. I guarantee you that smarter people out there can answer that in the comments. But that's my general sense as it relates to the different dosing. It's confusing, you're right. But if you remember milligrams per kilogram per day, you'll be okay. Okay. Thank you for so. I just started taking meds. Okay. Adjust. Let me sure. What? Okay. So I'm working with my provider to adjust. What should I be paying attention to help my provider adjust my dosage or my medicines? Man, this is great. I mean, if I only got 4 people watching, but they're as smart as you folks, it makes it worth it. This is great. Great question, Ann. Okay, so we have to think about metrics, okay? Because you get real lost in the weeds here. Because one metric could be, well, like Dennis and I were just talking about, what's the max daily dose? If you're on 108 milligrams of Concerta, it doesn't really matter how well it's working. We're not increasing it. Right. So if there's anything to discuss besides this is working great, no changes, it's going to be a different medication. Okay. So one metric is what's the max daily dose and are you on it? Okay. But let's talk about another metric. How beneficial is this? And this is the hard part. Only you can know that. But as a general rule, if you're taking a medication and it feels like a Tic Tac, okay, you take it and maybe there's a little bump, maybe you get a little bit of a boost in your focus and attention, but you're eating fine, you're sleeping fine, there's no discernible side effects, and there's only minimal benefits, you go up. And let me give you an example. In the clinic, I say to families this, I go, ADHD medicines go like this. It's either I love them or they're terrible. I love them, this is great, this is perfect, this is exactly what we needed, Noble, or I see nothing. Or the side effect profile is terrible. But if you come in like this, I'm going to go do whatever I need to do to make it go to this or make it go to this. That's it. Nobody gets to go like this. I don't really know. What do you think? I don't know, honey. What do you think? If you're doing that, go up. So is your max daily dose met? If not, you got room to work. Is it effective based on the time of day you most need it? Or in general, do you feel your body come online in a way that is most helpful to you? And then the third thing, Anna, I'd have you think about is, are the side effects palatable? Are you able to deal with this? Because maybe you're not. Maybe you're on a low dose, you're nowhere near the top. Maybe it's effective, but it's just turning you into a monster. That step off, in the end of the day, you drive your Honda Civic and you go home and then you're ravenously hungry because you haven't eaten anything all day and your kids need some support and some attention, or your spouse or your work-life balance, whatever it is all on fire. I'm telling you, I don't care how attentive you are to work. It's not worth it. The juice isn't worth the squeeze. So when you think about your provider and you think about things to talk about, come in with an idea about how useful this is, but have an idea also about where you are in the story, right? So like Dennis was talking about, know what the top end dose of these medicines are. You can Google it. It's really easy. Do the math. Are you close to 1.5 milligrams per kilogram per day of a methylphenidate product? Are you Adderall, so amphetamines? That's more like 1 milligram per kilogram per day to 1.5 milligrams per kilogram, whereas methylphenidates is 1.5 to 2. So do the math and then look at where you're at in terms of the max daily dosages, right? Because the math fails you once you reach the top dose. You don't keep going up. You don't do that. You have to stop. And if you know there's room to go up, it's not wrong to say to your provider, look, I feel like these medications are useful, but I feel like an increase would be more beneficial to me. I have no discernible side effects. I've not lost any, weight, because we'll look at your blood pressure. We'll look at your growth parameters. If you've lost 10 pounds and you tell me that this medicine has done nothing for you in terms of effect, unless you're doing something new from a health standpoint, I'm concerned that this medication is doing something, so I'm going to be able to see it physiologically. I'm going to be able to tell, and your blood pressure might go up by a titch, but those are the things I would think about right away. Okay. But don't be shy. And this is your brain. This is your life. If you're nowhere near the max dose and you're in a season of life when you really need benefit from this medication, it's okay to say to your prescriber, look, like I just need more support here. I need more support, and I'd very much like you to help me explore ways to make that happen. Okay. So don't feel one bit bad about it. That's nothing wrong with that. Thank you, everybody, for your idea. Okay, let's do one more. Do you treat ADD and ADHD the same? Stinging, great question, _B. Thank you for that question. And if I forgot, never I missed a question, put it back up and I'll look again. But great question. Okay, ADD, now listen, I'm not being critical. I get exactly what you're saying. But there was, I don't know if it was the DSM-4 or the DSM-5. I don't know which one it was. I think it might have been the 4. It might have even been the 3, where they got rid of ADD as an example. So ADD is attention deficit disorder. So there's no H. There's no hyperactivity. Now what we do is everything has a diagnosis of ADHD. So if you go to your doctor and your doctor says, you have ADHD, don't be offended. They're not trying to be mean, okay? But ADHD is the banner that hangs over all of these things. But underneath that banner, what do we have? Hyperactive and impulsive subtype, inattentive subtype, and combined subtype. Okay. So when we think about ADD, attention deficit disorder, what I think is probably going to be the closest current diagnosis is going to be ADHD inattentive subtype. Inattentive subtype. And I will tell you in general, yes. It does, from my perspective, it doesn't matter what kind of ADHD we're talking about here. If I need to reach it, I'm going to use a stimulant medication to do it. Now, there are times when there's variations on that rule. Let's say you are super hyperactive. You're wild, right? But you're wildly creative and you're doing all these great things, but you just need to be calm. You need to calm down. Sometimes then an alpha agonist like 10X or clonidine, sometimes that's what you do. Sometimes that's the right decision, right? That's not a stimulant, right? And also, if you have a really, like, let's say you have a low body mass index, you're not a big person, you don't have a lot of weight to lose, you already struggle with sleep, then I'm going to be more likely to do something else, or like, Qelbree or Strattera, those selective norepinephrine reuptake inhibitors. So there are nuances to how I prescribe medications, but it has more to do with who you are as a person, your body size, your comorbidities, your health concerns, and less to do with what kind of ADHD you have, okay? If you're safe to take a stimulant medication, if I'm prescribing medicines, I want them to work, and I want them to work now. What's the best way to do that? Stimulants. Ritalin, Concerta, Adderall, Vyvanse, boom, right? You've waited to see me. Why should you wait for me to help you? Let's get on to medicine and get going. Do you have tips for dealing with ADD in a natural way? Oh, thank you so much for asking that question. And if it's okay, can I go back a couple slides and I'll show you? For those of you who are watching, you're like, and you missed this slide, and it's okay. Now listen, let me show you this. Let me show you this slide. That's a great question, and I love that you asked it. No, so 2 truths here. Here's a quick list that I'm going to go over with you, okay? Real quick again, just to make sure if you have any questions. And the other thing I want to, hold on, you're clarifying. Dealing sounds like the wrong wording. I mean, do you have tips for when one can naturally do to live with a bit more clarity on hectic days at work? Oh, this is such a great question. Okay. So, and I apologize if this isn't what you're asking, but let me start here, and then I'm going to transition to some other things I want you to consider. Okay. So I do have a link in the description below on a previous live I did where I start a series on complementary and integrative strategies for ADHD. I love that you're asking this question. I want to see people helped. Okay. And I want to, sometimes that means medicines. Sometimes that means tweaking things in their life. So if you were to, remove preservatives, artificial preservatives like sodium benzoate, food colorings, if you were to add things like omega-3 fatty acids, if you get sleep, and I'm covering it up with my face, but the other point I make here is an exercise. Those are things, okay, that are absolutely evidence-based. Okay, now, am I saying that they're as effective as stimulant medications? Nope. Not even close, actually. Not even close. But if you can sleep and you can exercise and you can optimize your diet by eating some fish, right? You don't have to take fish oil pills. Remember what I said. Those things are gross, and they're not filled with honey, by the way. Don't bite into those babies. If you can supplement your diet with fish products, if you can supplement your diet with multivitamins, I think I left that off the slide, but there's some really great data to suggest using multivitamins. They're great. Now, you don't have to take, if you get into the weeds and you're like, well, I'm just going to take 1,000 milligrams or micrograms of magnesium or vitamin D. When you get into the weeds on things like that, you kind of get a little too far off the path. It's difficult to study the effectiveness of those strategies. You're better off to take a multivitamin, sometimes with iron, if you have a poor diet or you don't take a lot of iron, but not if you're constipated. Steer away from it then, okay? So that's an example of some natural interventions. But can I add one more log to the fire? Let me add one more log to the fire. There are steps you can take. Hold on. I didn't plan to do this, but I'm going to show you because you're my friends and it's 5 o'clock on a Friday. There are steps you can take. Okay. As an individual with ADHD, I'm the medical director of 2 facilities. I promise you, you can survive and thrive off of ADHD medications, but there's other things to think about besides fish oils. Okay, I'm going to hold it up. Don't be mad at me if it's not it. See this? This is a planner. I don't throw, it's your computer screen. You can throw tomatoes at it if you want to, but I have to write it down in a planner. Okay, you can put it on your phone if you want to. You go, you. I was talking to my watch. I do the thing. We are trained. We are trained to ignore things that beep. So if you have ADHD, right, you typically need immediate feedback, right? So sometimes beeps and bops and beepity boops and things like that are great for you. But for the majority of us, I'm telling you, I bet you ignore your phone. I bet you ignore it when it beeps at you because it beeps you all the time when you get a Facebook thing or blah, blah, blah. So I don't like that. I write it down. And I don't write it down just by a little, my friend. I write it down by a lot. Every day is in different categories of things. I've got spots blocked out. I've got things, I write to-do lists and I put it into the to-do list. And I'm working on another live, right, interview, an entrepreneur who has ADHD, and he tells us about all the things that he does. He uses timers. He uses all these different things. But my point is this. If you can set certain periods of the day to get on track, either the night before or the morning of, and you make it so that every alarm in your house goes off, not to tell you to do everything, but to tell you to stop what you're doing and go look at your calendar, I promise you'll be more effective. I promise. Okay. I'm living proof of that. Okay. All right. So thank you so much for that question. Genius question. And there's much more to say on this topic as we move forward in the future. If this has been beneficial, leave a comment. Tell us what you want us to do. Tell us if you want to do lives. Some of the lives I'm going to do in the future, I'm doing them where I'm interviewing people. Maybe I'm interviewing one of you, right? Maybe I'm interviewing doctors. I'm interviewing lawyers. I'm interviewing financial planners. I'm interviewing entrepreneurs so that we can have a conversation in real terms about what it means to have ADHD, what it means to raise a child with a neurodevelopmental disorder, what it means to have an autism spectrum disorder, what it means to use medications for sleep, and what genetic testing can be useful for you. These are all things we're trying to cover if it's useful. And if you have any additional questions, join us on drnatenoble.com, drnatenoble.com. I'm building the website. It's terrible right now, but it's going to be awesome. Thank you, everybody, for watching. And if there's no additional questions, I'm going to hang up. Wait, let me make sure. Oh, I did this one. Okay, thank you so much for watching. You guys, it was awesome. I appreciate your time.